Hi, I'm Kristina.
And I'm Sandra.
We are part of Sanofi Genzyme's CareConnect Personalized Support Services team. Today, we're going to talk to you a little bit about the CareConnectPSS program. But before we dive in, Sandra, can you tell us a little bit more about yourself?
Sure. I'm a patient education liaison at Sanofi Genzyme. I've been in this role for a little bit over 3 years now. As a patient education liaison, or PEL, I'm available to provide additional disease as well as treatment education to help you and your family understand your diagnosis and engage in informed decision-making with your healthcare team.
And your background is in genetic counseling, right?
Yes. So I have a background in genetic counseling. And as a genetic counselor, we are trained and specialized in helping patients collect family medical history. We do this in efforts to understand how genes are passed down in families and also to understand who else in the family may be at risk for developing certain diseases. Now, Kristina, can you tell us a little bit about yourself?
Sure. I've been fortunate to work for Sanofi Genzyme as a case manager for over 12 years. My background is in clinical social work, with the majority of time being spent in healthcare settings. I'm honored to be able to support patients and families like you with your healthcare needs. Today, we'll focus on what case managers and patient education liaisons can do to support you. Sanofi Genzyme has been committed to supporting the rare disease community for over 35 years. It is our passion to help patients and families living with a rare disease and to focus on putting the patient first. Many of you submitted questions prior to this webcast, so Sandra and I will take the time to answer those at the end of this webcast. Living with a chronic illness such as a lysosomal storage disorder can be a very challenging journey. But it's not a journey that you have to take alone. CareConnectPSS is a nationwide patient support program that provides access to a variety of resources. People who are either newly diagnosed or already receiving treatment can get support from their dedicated CareConnectPSS team members. Participation in this program is free, voluntary, and confidential. When you begin working with CareConnectPSS, you will be assigned a dedicated team, including a case manager and a patient education liaison, who will work with you to understand your specific educational needs.
And as you move throughout your diagnostic journey, your dedicated team will work with you individually and offer support that can be tailored to you. We also understand that circumstances in your life may change. You may move, you may enter college, graduate college, or change jobs. And we are here to help you address and adapt to these challenges. So let's talk a bit more about your CareConnectPSS team and how we are here to help you. Your CareConnectPSS team is made up of your dedicated case manager and a PEL. Kristina, can you tell everyone a little bit more about the case managers?
A dedicated case manager will be your primary point of contact at Sanofi Genzyme. We provide care coordination to support you and your healthcare team, as well as connect you with local and national resources that may be available to support you and your family. One of the biggest challenges in managing your own healthcare can be understanding health insurance. The good news is that our case managers definitely know insurance. We're experts in health insurance and navigating the healthcare system. If you're just starting treatment, we can help make it easier by verifying your insurance benefits to determine coverage and help you secure any required authorizations or referrals. We'll help you to understand your insurance options during open enrollment or at other times when you may be changing insurance providers. There may be occasions when your life situation changes. Maybe you start a new job, get married, or are no longer a dependent on your parents' plan, and we can also help you with those insurance changes. Our approach is to try to be as proactive as possible. We try to get ahead of any barriers. We'll reach out to you periodically throughout the year and ask you about any insurance changes, moves, new employment, or new doctors. We definitely try to tackle any issues as early as possible. The costs involved in managing your rare disease may also be a bit intimidating should you experience any out-of-pocket expenses. Your dedicated CareConnectPSS case manager can help you understand and manage the costs related to treatment. We can assist you in managing out-of-pocket costs, follow up on denied claims and appeals, and refer you to financial assistance programs like the Sanofi Genzyme Copay Assistance Program. This program helps eligible individuals in the United States who are prescribed a Sanofi Genzyme treatment pay for eligible out-of-pocket drug-related expenses, including copays, coinsurance, and deductibles. For people who don't have insurance or who may have inadequate insurance coverage, Sanofi Genzyme has a charitable access program. This program can provide temporary assistance to eligible individuals in the United States. Your case manager can give you more information about each of these programs and let you know whether you are eligible. Aside from helping you navigate insurance benefits and costs, your case manager can also help you identify doctors that have expertise in managing your condition. Whether you were just diagnosed, moving, or even going on vacation, we can help provide medical facility options within your geographic area. That includes treatment centers and any other resources related to your care, such as home infusions. Bilingual case managers and patient education liaisons are also available to provide in-person and phone interpretation in Spanish. Professional phone interpretation services can be provided upon request for other languages as well.
Kristina, can you tell us now a little bit as to what you find most rewarding about being a case manager?
Sure, I'd love to. I feel incredibly fortunate to be able to partner with patients and families and empower them to make the best decisions for their healthcare needs. At the end of the day, we really try to provide you with some relief around managing your medical condition so you can focus on you. So Sandra, now it's your turn to tell us a little bit more about patient education liaisons. What support can patients expect from PELs?
Hearing the news that you, a family member, or a loved one has a rare health condition can be frightening and oftentimes very overwhelming. You may find that it may be difficult to understand or to even explain such a complex disease to others. Many people, including friends, family, or even some healthcare professionals, may not have heard of the disease or have limited information. PELs typically have a background in either nursing or genetic counseling. As I mentioned before, my own background is in genetic counseling. PELs will break down complex medical information so that's easy for you and your family to understand if needed. We'll coordinate and lead discussions to educate you, your family, and your friends on your disease. This way, everyone involved has accurate and clear information about your condition and what to expect. We'll tailor the discussion to fit your needs, whether it be an in-person, a face-to-face meeting, or a phone conversation. PELs are regionally based, so you'll have someone who's available nearby to meet in person if that's what you would like. It's important not only for you and your family to understand your condition, but also for everyone and anyone who may be part of your support community. School teachers, college professors, coworkers, supervisors. If you're interested, we can also coordinate meetings and presentations to help them better understand your diagnosis and the challenges you may face.
You mentioned that PELs can provide information about other family members who may be at risk. Are you able to talk more about what at risk means?
Of course. When someone is diagnosed with a rare genetic disease, other members of the family may wonder, am I at risk for having this disease also? What are my odds? PELs will work with your family to understand how lysosomal storage disease is inherited and passed down in families. We can even help complete a medical family tree to help identify additional family members who may be at risk.
That's a really great explanation. Are there any other offerings that you'd like to share?
So for those patients who are on treatment and may be transitioning to the home setting for infusions, PEL can also assist in this transition. We can deliver in-depth disease and product and services to home healthcare professionals prior to treating patients with enzyme replacement therapy at home. We are here with you through every step of the way and want to ensure everyone involved in your care is knowledgeable and prepared.
I know it's hard to pick just one, but what do you find most rewarding about your job?
That is a hard question, so I'll give you a couple.
Okay.
One of the parts of my job that I find the most rewarding is having the opportunity to witness the strength, the resilience, and the perseverance that many of the patients have, even when faced with new levels of uncertainty and unpredictability. Also, my native language is Spanish, so it's also particularly fulfilling to be able to provide disease education and support to Spanish-speaking patients and their families through a common language. In our team, we have dedicated Spanish-speaking PELs who are available not only to provide support and education via phone, but also available to travel and meet with patients and their families in person if needed.